Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
So let's begin tonight's class on contraception. So first of all, the introduction. Why do you need contraception? We need contraception to delay the pregnancy, at least till the time period and the zone in which we are comfortable, right? So there are certain temporary methods, there are permanent methods, which are actually the whole basket is called as contraception to prevent the pregnancy and basically arising either from unprotected sexual intercourse or an untimed intercourse, right? An accidental intercourse. An ideal contraceptive has to be safe to use, pretty cheap, widely, not only widely available, but also acceptable, very, very easy for compliance, should be highly effective, and it should require minimal motivation, maintenance, and supervision. So if you have all these things satisfied, well, it's going to be an ideal contraceptive method, which is yet to strike. Now, if you want to know the efficacy of a contraceptive, we've been speaking about the most important thing happens to be what? How effective this contraceptive method is. And then we go on to the next, slide or the next thing, which is also equally important. So the most important thing about any contraceptive which is coming in the market or coming to us is the fact that how efficacious is it? How good is it in kind of allaying the pregnancy for which we're using it? So the efficacy of any method of contraception, it can be calculated in a variety of ways, but the most, studied method is the one which I'm going to discuss with you right now. So what we do is, we take the number of pregnancies experienced during 100 woman years of use of the method. That means a woman year is defined as 12 cycles. So there are 12 cycles that becomes a woman year. And we take such 100 years, okay, and are standardized by 1 year, 2 year, 5 year cutoff points. And how do we use you get to know the failure rate of any contraceptive? We calculate by using the Pearl Index. Okay, so a short note can be asked on Pearl Index. You have these 2, 3, and 5 marks questions, right? So Pearl Index can be a 2-mark question. Pearl Index, number of accidental pregnancies into 1200, which is what I just spoke to you about, 100 woman years, okay, to 1200, divided by number of patients we observed into the total months of use, the total months of exposure. And I'm going to describe it even further over here. For example, suppose you took 100 couples, they were using a contraceptive method for a period of, let's say, 3 years, which is 36 months. And there were 24 pregnancies, okay? Ideal use or non-ideal use, whatever it was, there were 24 pregnancies. So how do you calculate the Pearl Index? How do you calculate the, the failure rate? So you multiply 24, which is the number of accidental pregnancies, into 1200, which is 100 woman years, which is a constant, divided by 100. And that you multiply into 36 because the number of months that we use. So how many couples you took and how many months you followed them up for. So 36. And this, suppose it comes out to be 8. So this is pretty efficacious. Why? Because now listen to this. Efficacy is considered high if the pregnancy rate is below 10. So here it is 8. So that means it's pretty efficacious. This method is pretty efficacious because the failure rate was around 8. But it is low if the pregnancy rate is above 20. So if anything is above 20, that means the failure rate is pretty high, and that is not a very efficacious method. So in very crude terms, you can say anything below 10 is good, anything above 20 is bad. Okay. So based on this Pearl Index and based on these 100 woman years typical usage rate, we're going to go ahead and describe some of the contraceptive methods later. But before we do that, let me tell you what you mean by WHO medical eligibility criteria. Now, when we were talking about the contraceptive methods, the most important thing which I spoke to you right in the beginning was about how efficacious that method is. Only then you're going to follow that method, yes, right? So if you've taken, the best of the best lot, and if that's not working for you, let's say, for example, you took a pill and that pill is very good on your body, okay? It's not going to cause any side effects, no nausea, no vomiting, no gastric upset. Even if you forget the, pill is going to be just fine. For 1 or 2 days also, it's going to give you cover. But later on, you get to know that it's not that efficacious. It's not giving you any side effects, but it's not that efficacious in, handling the pregnancies. Would you consider that method? You would not. In that case, what happens is that the most important aspect of any contraceptive to be hit in the market has to be first and foremost very, very efficacious. But at the same time, like another second prong, what is also important, the safety profile. Okay, so you may be having the best. I'm just going to reverse my statement. So you may be having the best, most efficacious contraceptive around, but it's not working on your body in the way that it's causing a lot of side effects. Okay, a lot of side effects. Bloating or weight gain or mood upset or decreased libido. You wouldn't want to continue with that highly efficacious contraceptive method, despite it being so good in preventing pregnancies. So here is where this medical eligibility criteria comes. So let's talk about an absolutely healthy female. She has a basket of, contraceptive devices available for her. But what about those females who are, let's say, having SLE or who are having chronic renal trouble or chronic renal failure, or, those patients who are some heart ailment, hypertensive females, diabetic females, hypothyroid females, or hypothyroid along with chronic renal failure. So there are multiple combinations and permutations, all right, which are available in so many patients, you see. No two patients are alike. Everybody has a different permutation and combination of some or the other disease, right? So what combinations or what contraceptive will be best for them is decided by this medical eligibility criteria. And why is it so important? Why is it so important is because it's been thoroughly researched. Okay, when you talk about medical eligibility criteria, nothing I've seen so far, guidelines on so many aspects of so many things, nothing has been studied and researched and made guidelines into as much as medical eligibility criteria. So for us to know what is category 1, 2, 3, 4, where does your contraceptive device stand for you having this particular medical problem, is actually the idea of medical eligibility criteria, MEC to be short, and it's been researched and produced as a wheel, as you can see over here. Basically, it's the other prong of the contraception. So one thing is how efficacious the contraceptive device is, and second is how safe is it for you to use given your particular condition. Like I said, a healthy female, no problem, but a female who has 2 or 3 multiple problems, heart ailment, or just delivered, or lactational period, or just aborted. So many permutation combinations are there, with fibroid, without fibroid. So what device, what contraceptive method will be best suited for her? This is actually one of the things which are spoken to about in MEC. So for you and your given condition, which contraceptive method is the best? In what category does? For example, if a person comes to you with GDM and asks about the contraceptive devices, and she's heard a lot about COCPs, POPs, and injectable, these implants and IUCDs. So she asks you about which is going to be the best for her. You don't choose the best for her. You just tell her that implants fall in category 4, or COCP is category 3, or IUCD category 1. She's intelligent herself to pick up which she wants, and then she'll ask you, okay, fine, if I choose IUCD, what are the advantages and disadvantages? Then you have a different thing to tell her.